Hi, I'm Anna Johnson. Welcome to my second lecture on malaria. You may remember a little bit about the pathophysiology concepts of malaria, specifically that when we say we have the disease or we have the symptoms, it's here in this red blood cell stage when the parasite is taking over your red blood cells. So your red blood cells can't carry oxygen or nutrients or waste. The red blood cells get very big and start to occlude blood vessels, and then they eventually lyse, causing severe anemia. You can have malaria patients with hemoglobin of 7, 6, 5, no joke. And then once these red blood cells lyse and you have this bad anemia, your plasma also becomes really sludgy with all of these thousands of gametocytes. And then 48 to 72 hours later, it all starts again. So the symptoms are cyclical for the reason I just explained. Your patient will have likely fever and headache. Probably can be sweaty and have those really bad chills that I talked about before, and may have nausea, vomiting, maybe not have diarrhea. When we get the really severe malaria, this is from the hypoxemia, from your red blood cells not being able to transport oxygen, vessel occlusion from your red blood cells being so big and occluding your tiny capillaries, and vascular permeability. So each time you get malaria, it's probably going to get worse and worse. Like your day 1, it could be okay. Day 4, it could be really bad. Day 7, it could be terrible because your blood vessels are already somewhat occluded and you're already having this bad anemia. So we're looking at organ failure, liver, kidney failure, spleen rupture, hypoglycemia, pulmonary edema from that vascular permeability. Vital signs of your patient will generally be increased, but blood pressure is low because of that vascular permeability. You can't keep blood in your blood vessels and you have this really bad anemia. Patient's skin is probably going to be sweaty, clammy. Patient might have really bad chills and will probably have jaundice. Pallor from decreased oxygenation, puffiness, and the patient's probably going to be prostrate because they feel terrible. Neuro, your patient's probably going to have a headache. Those other symptoms come with severe malaria. The scleral icterus, that's when the white of your eyes becomes yellow from all that high bilirubin. If you listen to the lungs, you might notice crackles. Abdomen you might be able to palpate the liver or the spleen. Patient's going to have GI issues. And then just general muscle aches and joint pains. So diagnosing malaria, for years we did clinical presentation, which was wildly inaccurate. You seem like you have malaria, we'll treat you for malaria. People are treated unnecessarily, people aren't treated and they die. And then for a few decades, microscopes were the gold standard, and we were pushing to get, I don't know if anyone remembers us pushing to like fund microscopes to go out in the tropics into remote places so that lab technicians like this guy locally can look at your blood smear and see if you have malaria. Now we have rapid diagnostic tests, which are cheaper and more available and more accurate. So this is what malaria could look like in the microscope. Could look like just about anything because there's so many strains of malaria and there's so many stages of the life cycle. So you have to be a really good lab technician to be able to recognize it. You have to be used to seeing malaria. So here's an RDT. So they cost maybe $1 or something like that. A lot cheaper than going and getting a blood smear done. This patient looks like they're positive for Plasmodium falciparum and PAN. That just means whatever other kind of malaria this one tests for. I don't know if you remember our little 4-year-old girl who came out from the US to Ghana a few months ago. So Monday she woke up and her mother didn't want to send her to her Montessori school because she was flush, she had malaise and a little fever, her heart rate was a little bit fast, and so were her respirations. Tuesday, Wednesday, and Thursday morning she was fine. Thursday afternoon, she came home from school with a fever of 104. Heart rate was 130, respiration rate was 32, and she said she had a headache. So her mother calls the lab. They say that they'll have someone come out in the morning to do an RDT. Friday morning, she seems fine. Mother still has her do the RDT and she tests positive for malaria. My questions are, for what other illnesses can malaria be mistaken? And what makes the asymptomatic cycle of malaria dangerous? Here are my references, and thank you for